Hi, everyone. Dr. Jim Augustine. This week's session on DocTalk. DocTalk this week is good news, and it's about a lot of events going on in and around COVID. So we're at the end of February. We are across the country having significant, profound decreases in the number of coronavirus cases. Most areas are really out of the thick of COVID, including Omicron. There's some news this week about a variant of the Omicron, which has been designated BA2. BA2, a little more infectious than the original BA1 variant Omicron. At this point, though, resistance for people who've been infected before, the vaccinations and other treatments effective against BA2. A couple of other countries that weren't heavily affected by the BA1, which we were, have had some issues with BA2. We do not anticipate that there will be big problems with the BA2 variant. So as you read the news, make sure you keep up to date. But at this point, it is not likely that BA2 is going to cause significant problems on this continent. The unfortunate news of the week is that we passed the number of excess deaths in this country by 1 million since the beginning of 2020. So right about the beginning of the pandemic, there is a usual curve of deaths that occur in this country from all causes: injuries, illnesses, cancers, long-term diseases, etc. We have a usual count of deaths. Unfortunately, that began to go up at the beginning of the pandemic, and it has stayed at an elevated rate since then. What that means for all of us is that not only is COVID itself causing deaths, but the changes in our healthcare system, the changes in the way people could be treated for underlying diseases, including cancer and heart disease and other things, has changed so much that there have been more people dying than otherwise would have died in usual years. That's a tragedy, and that's a significant effect of this pandemic. So beyond, some hundreds of thousands, they think the number's about 700,000 deaths so far in the United States from COVID itself. There's excessive deaths that clearly are related to the pandemic. We are still, as of the 1st of March, in a national emergency situation and a public health emergency that will last until at least the middle of April. That allows states and other organizations to continue to work under emergency conditions to get the jobs done that are so very important to us in the public safety arena. A couple of notes about the coronavirus itself. The Omicron variant continues to have relatively lower acuity than prior old variants, and we don't see a resurgence of any of the Delta and other variants that were much more dangerous. It is likely that very large numbers of people even haven't been reported having the Omicron variant, and that has, within all of us, built our immunity as a population. What that means is that future attempts for COVID to make us sick are going to be less successful because a lot of people have had jabs and they've had the disease itself. What we believe right now is that 3 events, like an illness and 2 vaccinations, or 2 vaccinations and then a breakthrough illness, gives you significant protection. And so many of us have had either 3 immunizations or an infection and 2 immunizations. And that provides us with excellent coverage against serious disease and death. And that's really important. Treatment arena, you've heard a lot of news. Last week, another treatment was approved. It was an infusion, a monoclonal antibody. It will be added to the armamentarium, but right now all the treatments are coming through very slowly. So there are very small numbers of them, and they're being reserved for people who are at the highest risk. So we have a couple of oral medicines and at least 2 infusions that get put into a vein that have been approved for use against people with COVID disease, but they're available only in small amounts. There is an additional monoclonal antibody that's available as an IM injection that is intended to protect people from getting COVID if they can't get a vaccination. That's Evusheld, an injectable monoclonal antibody, and it's intended for people who can't get vaccinations. A very important study was released this week. It says that ivermectin, which is a drug we use for worms and other parasites and is used in veterinary medicine a lot, did not work in preventing people from getting serious illness or dying of COVID. So ivermectin is not a proven treatment in any way. And as a matter of fact, when you count the complications of ivermectin from taking it, it is a negative. So ivermectin has not worked. We're still looking at other medicines that potentially can protect people. What we're focusing on now in many of our activities, and I had to write up this week for the IAFC newsletter, is what we're calling off-ramp strategies. Those off-ramp strategies are talking about us getting through the surge of a big wave of COVID cases and how we are going to return in an organized way to our usual way of doing business. In public safety, that typically means us reducing our use of masks, reducing our use of other personal protective equipment, PPE, our ability to do our activities like public education, blood pressure checks, going and doing investigations without the higher level protection or without being able to do it at all. That's a really good set of events to plan for. It is different than the set of events that prompt us to get on the on-ramp, which is when the cases are going up and we have to begin to introduce restrictions on what we're doing and how we're doing it. One really important piece right now to our winter operations is people still cannot come to work sick. And that's really important because even as COVID is going down, we have other infections that are coming up a little at a time. So let's talk about flu. Flu this year has been at a very, very low rate. Influenza A has been the primary bug. It is covered this year by the influenza vaccination. It has been rising at a very low rate, but as we go back into public events, we take our masks off in public and other mask mandates are reduced. We are going to see some flu cases. We're going to see some other respiratory infections, our usual seasonal pneumonias, strep, and other things that will be coming back. Some of those patients get sick enough that we get calls and we're asked to transport them to the hospital. The hospitals stay busy with their usual winter business, the usual slips and falls. And as storms are going through winter storms are going through the country again, we still have our winter problems to get through. And really important for all of us that sick people stay home and don't give their infectious diseases, even if they're not coronavirus, to others. So we are about 4 weeks away from springtime. We have the opportunity to beat this thing and beat down the pandemic, get on that off ramp and successfully and safely get back to normal operations. Keep each other from getting sick, keep us from getting infections from the public and us giving infections to the people that we serve. And then by warm weather time, really be moving much towards our normal sets of operations. That is really something to look forward to as we get to this. At this point, we're not seeing other variants across the globe that would be of concern. And by now, again, many of you have gone through and been infected already. We've had such a large number of people infected that our herd immunity is getting to a very much higher level. And that should protect us from future big outbreaks. For those of you with long COVID, next week we're going to review long COVID. There's still very good reasons to get vaccinated at this point against COVID or to get that third jab if you need the third jab and haven't had an infection. There's also some evidence that is growing that long COVID Some of the symptoms are relieved when you get the vaccination. It somehow stimulates your immune system so that you reduce the complications that came from having COVID before. All good news to give you at the end of February. I love being able to introduce good concepts, new ideas about how we get back to normal. I hope you all are enthused about doing the same. DocTalk, end of February. Good news to be given and received by all of you. Be safe as we get through the end of winter here. Thanks a lot.